Hello, my name's Nigel. I'm a nurse consultant in palliative care, and I've worked in palliative care for over 20 years now. What I do know is that end-of-life care is everybody's business, and everybody who works in healthcare really needs to know something about conversations around dying. I know that having conversations about dying can be frightening to people, and I think that's completely normal. As human beings, we're afraid of death. However, sometimes patients that we see will want to talk to us, and I think all it takes really is to give people permission to have that conversation, because just listening to people is often all that's required. And I know that healthcare professionals can often feel about saying the wrong thing or not knowing what to say, and that's okay, but let's try inviting the conversation and giving people permission to talk. We fear these conversations because we think we need to know what to say, but sometimes just giving people permission to talk to us is all that's required. So why are these conversations important? So I know as a palliative care nurse that when these conversations go well, they can be really rewarding. And I think that's probably the same for everybody, that when we have good interactions where we feel we're helping people, we get a good sense of satisfaction about our work. We have a role in making sure that people die as well as possible. And the conversation about this is important too. People often feel that they're losing a sense of control when they're approaching the end of life, and having a conversation about dying can really help people to feel like they have more control about what's happening to them and their future. In my experience, people often know that they are approaching the end of life, and therefore it's so important that we give people the opportunity to have these conversations to prevent anxiety and tensions building up.
Were you in the band?
No. I just used to play for family and friends.
Do you still play?
Not anymore. Am I dying?
What makes you ask me that, Ali?
I don't seem to be getting any better.
Okay.
I feel as if I'm going backwards.
I think you're right, Ali. I think you are dying.
I'm ready to make my peace.
Okay. Is there someone you want to make your peace with?
Yes.
Who is that? Who is it you want to make your peace with? Ali, is it your daughter you want to make your peace with? Ali? What's her name? Ali, what's your daughter's name?
Summer. Summer.
Have you tried speaking to her? Ali?
It's too late for that.
It doesn't have to be. How about you write her a letter first? How about I help you write it?
Yes.
When we as healthcare professionals miss the opportunity to have these conversations, it can really have a negative impact on the care that we deliver. I'd like to tell you a story about a patient that I recently looked after. I was asked to go and see a man at home who had been discharged from hospital. He lived with his wife and they were both in their 80s. He'd been in hospital following a fall at home and he had a diagnosis of dementia. While he was in hospital, as often happens, the team in hospital did lots of tests on him and they came up with a diagnosis of lung cancer. And during his long stay in hospital, no one spoke to him or his wife about the new diagnosis of lung cancer. So he met with lots of different health professionals, none of whom took the opportunity to talk to him or his wife about his new diagnosis. So here I was visiting this man and his wife, and they didn't know why a member of the palliative care team was visiting them. And through the conversation, it became very clear to me that no one had told them of their lung cancer diagnosis. And unpicking this with them, I quickly realised that I needed to let them know why I was there and what this man's diagnosis was. It was obvious to me as soon as I met him that he was in the last weeks of his life and approaching his death. But no one had had this conversation with him or his wife or given him the opportunity to have this conversation. And we do know that when people are prepared for the end of their life, and families too are prepared for the end of life of their loved one, that they can make plans for the short time that they have left. And because this was obvious to me that this man was dying and approaching the end of his life, it felt important that I gave the wife and the man himself an opportunity to ask me questions. So I invited the conversation by asking them if they had anything that they wanted to ask me about the future and the next short while, and if they were worried about anything in relation to him and his care. And by giving the opportunity for these people to ask me questions, the man himself said to me, "Am I dying?" And of course this was a golden opportunity for me to continue that conversation. And by me acknowledging that I felt that he was right in his feelings, it opened up a conversation which enabled us to think about the future and what was important to them as a married couple and him as a man who was approaching the end of his life. And on reflection, thinking about this man, I can't help but feel that there were obstacles in the way of him getting the information that he needed to help him and his wife prepare for his death. These obstacles may have been that he was from an ethnic minority group, or that he had dementia, or that he was elderly. All of these three things can be barriers in communication with people. When thinking about how to begin these conversations, we need to think about all of these factors that make the person who they are. And I've mentioned that this man was elderly, he had dementia, and he was from an ethnic minority. So all of these things are at play when opening these conversations. So when we're beginning these conversations, we need to think about who the person is in front of us and what matters to them. And what matters to them may be something around where they're from, where they were born, what cultural background they come from, and what religion they come from, and who they have supporting them. Think about the words that you use to make sure that they understand you. Imagine you were the patient. How would you like to be spoken to? What I've noticed, having these conversations can lead to improvements in how people are actually feeling. And this might be that their pain is reduced, or they start sleeping better, or you might see that tensions are reduced within a family. Sometimes as healthcare professionals, we're afraid of causing distress, and that may be why we don't have these conversations. But actually the inverse is true, that opening up can really help to reduce tension and anxiety in people.
I actually really worry about where to start and what to say. I don't want to sound too blunt and upset them, but I also don't want to be so ambiguous that no one can understand what I'm saying. I still worry that if a family are really devastated, is it because I've explained it badly, or is it just that the situation itself is really sad?
I think one of the most important things is for us to be upfront and honest with patients and families, especially when it comes to those uncertain cases. It's about being honest and saying, your dad is really unwell and we're really worried about him. These are the treatments we're giving him to get him better, but there is a chance they might not work and he might die during this admission to hospital. It's important to keep talking to families, even if it's just to say, we aren't sure.
The ups and downs and the uncertainty of it all can be so hard to get your head round. One day you're told that he's dying and you rush to the hospital and you call the family. And then the next day he's a bit better again. But hard as it is, it really does make a difference with them keeping us in the loop.
Over the last few months, I've had a lot more experience, and I feel happier admitting that I don't know something. I don't feel that need to have all the answers all the time, and that's actually okay.
Dad became really unwell. The doctors told us he might only have a few days to live and that he wasn't well enough to leave hospital and come home. And then later, the doctor from the morning came back to check on us. Oh, it made me so happy that she bothered to come back, and it meant so much that she took the time to check on Dad and explain things to us again. So when they came back that final time, it just made things that little bit easier and clearer too. It meant a lot to all of us.
As healthcare professionals, we can be afraid about saying the wrong thing or about getting upset ourselves. From time to time, I get upset when I'm having these conversations with people, and I think that's okay, as long as I remain focused on who I'm there for. Personally speaking, the more I've had these conversations, I feel I get better at it, and I think you will too. I think it's probably helpful to have a number of commonly used phrases that can help us to start these conversations with people. And here are a few of them now. Question 1. What is your understanding of where you are and of your illness? Question 2. Tell me about your fears or worries for the future. Question 3. Tell me about your goals and priorities. Question 4. What outcomes are unacceptable to you, and what are you willing to sacrifice and not? And question 5. What would a good day look like? Sometimes there are obvious situations that bring up these conversations, like the one I mentioned earlier, where someone asks, "Am I dying?" However, there may be less obvious situations that crop up where it would be a good opportunity to start talking about what you think is happening with that patient. For example, a relative might ask you why someone's breathing has changed, why someone is sleeping more, why someone doesn't want to eat or drink anymore, or why someone is struggling to drink. There comes a time when we need to move the conversation on or end that conversation. So some useful ways of bringing a conversation to a close where the patient feels supported and doesn't feel closed down could be that you offer the patient another appointment. So you suggest that we follow this conversation up at a later date or a later time. By suggesting to the patient that we leave the conversation there for now, you might ask them if there's someone else they would like to continue talking to other than yourself, and this could be a family member or a friend. And you could also bring the conversation to a close by asking the person what they would like you to do now. And remember, these conversations can be hard on us as healthcare professionals. So when we get back to our offices or to our bases, it's important that we debrief and that we talk to colleagues about how the conversation went, how it made us feel. Because talking about these things can help us do it differently and better the next time.
My husband was 89 years old and he was in a care home, and unfortunately one day he collapsed and was rushed to the nearest hospital, where I was told he was moribund. Even though it was a shock, I have to say it was very important to be able to have conversations with professionals who were able to help me to come a little bit more to terms with it, and were very helpful in suggesting that I call my family immediately. Having had these conversations, it enabled me to think more practically and to try to prepare myself emotionally for what the future would be, because it was quite clear they had told me that he would not survive 24 hours. Having been told he was going to die, he lived for another 6 weeks. During the time he was dying, I think the most important thing to me was the ability to be able to talk with the professionals about everything that they were doing and what the future would mean from literally hour to hour. I think it's very essential to talk to people, to tell them, to keep them informed, and not to be afraid to talk about dying from the professional's point of view, because I think ultimately the family do appreciate being included and having felt that they are fully engaged.